Today we will learn about acute lymphoblastic leukemia. Acute lymphoblastic leukemia, or AL, is a malignant neoplasm of lymphoid progenitor cells, characterized by the clonal proliferation of immature lymphoblasts in the bone marrow, blood, and other organs. It represents approximately 80% of childhood leukemias and 12% of all leukemias overall. Patients typically present with signs of bone marrow failure, fatigue due to anemia, infections from neutropenia, and bleeding from thrombocytopenia. Other findings include bone pain, lymphadenopathy, hepatosplenomegaly, and mediastinal masses, particularly in T-cell all. Diagnosis relies on complete blood count, showing anemia, thrombocytopenia, leukocytosis or leukopenia, peripheral smear and bone marrow biopsy, revealing greater than 25% lymphoblasts, immunophenotyping to differentiate B-cell versus T-cell origin, and cytogenetics and molecular testing, including BCR-ABL1 fusion, also known as the Philadelphia chromosome. Acute lymphoblastic leukemia arises from arrested lymphoid differentiation, most commonly affecting B-cell progenitors, known as B-all, but also T-cell precursors, referred to as T-all. Key mechanisms include chromosomal translocations, for example T922 in Philadelphia chromosome-positive all, and mutations in transcription factors regulating lymphoid development such as Tal1-Pax5 and IKZF1. Philadelphia chromosome-positive all occurs in 20 to 25% of adults and is associated with poor prognosis. Page-like all, sharing gene expression with Philadelphia chromosome-positive AL, represents approximately 15% of pediatric cases and is linked to a high relapse rate. Hereditary syndromes such as Down syndrome and Bloom syndrome increase susceptibility. Environmental exposures like radiation and benzene also contribute. The incidence of acute lymphoblastic leukemia, or AL, is approximately 1 per 100,000 people annually, with peak occurrence between ages 2 and 5. In children under 15, it accounts for 85% of leukemia cases. Treatment involves multi-agent chemotherapy, central nervous system prophylaxis, and in high-risk cases, hematopoietic stem cell transplantation. The 5-year survival rate exceeds 85% in children but is lower, approximately 40% in adults. Novel therapies include tyrosine kinase inhibitors such as imatinib for Philadelphia chromosome-positive AL, CAR T-cell therapy, and bispecific T-cell engagers like blinatumomab for relapsed B-all, and genomic profiling to identify high-risk subtypes for targeted therapy. Acute lymphoblastic leukemia is a complex, genetically heterogeneous disease with excellent outcomes in pediatrics, but challenges in adults. Advances in molecular diagnostics and targeted therapies continue to reshape prognosis and treatment. This material is intended for educational purposes only and should not be used as a substitute for professional medical advice, diagnosis, or treatment. Subscribe and learn every day. Until next time, thanks for watching.